This is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the COVID-19 pandemic update with data accurate through February 24th, 2022. This week, I'm going to answer two questions. How is the pandemic progressing, which is a question we ask every week. And then this one is a little unusual. What should we learn from Malawi? And I'll come to that in a moment. So how's the pandemic progressing? Well, we're continuing to see the pattern that we've seen before. After this massive spike in cases, largely due to Omicron, we are seeing a consistent decline in cases. And though while it's still coming down, the number is dramatically higher than it has been at any other time in the pandemic other than during the Omicron spike. In terms of daily deaths, we're also seeing a decline. But again, you can see it really clearly here. While the number of daily deaths is down over a couple of weeks ago, it's still higher than it's been at almost any time during the pandemic, except the three previous peaks. Almost 6 million deaths worldwide to date. And we're seeing a similar pattern in the United States, a dramatic decline in the number of cases, a decline in hospitalizations, and a welcome decline in deaths. But again, point out that even with this decline in deaths for the last several weeks, the daily number of deaths is about where it was in the first spike in 2020 and during the fall spike of last year. And unfortunately, only an optimist would look at this and say it looks like it's over, because it doesn't. Almost 1 million deaths in the US. We'll talk about that in an upcoming weekly update. If you look at where the cases have been, starting about 9 weeks ago, there was very few cases, and then all of a sudden it just exploded everywhere. And that's very consistent with this very acute spike in the Omicron cases. And go up, come down, and as you can see, we're almost back to where we were about 3 months ago, except for here in central Appalachia, looks like Maine, Alaska, the US-Mexico border, and a little bit in the upper Northwest. Why we're continuing to see a high number of cases in our region, we'll have to wait and see. In terms of Tennessee, we are seeing a reduction in the number of cases, though it's not as sharp as it was in other parts of the country. It looks like it continued to spread here a little bit longer than it did in other places. We are seeing reductions in hospitalizations and reductions in deaths, but we're still a little bit higher than we were during much of last spring and summer, and certainly more than we were in the first 6 or 8 months of the pandemic. About 24,000 deaths to date. Here in the Ballad Health region, where as of yesterday, they had 300 patients in the hospital. And while that's down, it's hard to wrap your mind around 300 patients in the hospital. So how's the pandemic progressing? This current surge is definitely coming down. We're seeing reductions in cases, hospitalizations, and deaths, but we're still nowhere close to a point where we can raise our hands in any sort of victory. Now, what should we learn from Malawi? Malawi is a country a landlocked country in eastern southern Africa. It's an absolutely gorgeous country. Some call it the warm heart of Africa. And it's had 3 distinct spikes in cases, 3 distinct spikes in deaths. But it's not about COVID that I want to talk. Something else, and that is Malawi just reported the first wild polio case in Africa in the last 5 years. A young child is paralyzed from polio, the first time an active case of wild-type polio in Africa. Won't come as a surprise to anyone that polio was once one of the most feared diseases in the United States. In fact, early into my lifetime, it was one of the most feared things, and because the consequences were so significant. Fortunately, it has been reduced dramatically, in part because of the discovery of vaccines by Albert Sabin on the left and Jonas Salk on the right. And then in the 1980s, those vaccines were really in the quite a bit before 1988. But the reason 88 is put up there is that's when the world decided to really attack polio and try to eradicate it. When they started, polio was in 125 countries. By 2 years ago, it was down to 2, just Afghanistan and Pakistan. In that time period, 32-year period, polio cases have been reduced by 99.9%. It's estimated that 18 million children have been saved, spared from paralysis, and about 1.5 million deaths have been prevented. Now, here's what's interesting. According to WHO, the vaccination rate in Malawi for polio is 93%, very high. In fact, higher than in the States or in Canada. And yet, despite that high vaccination rate, they ended up with a wild type polio case that looks like it came from Pakistan. So someone from Malawi traveled to Pakistan or vice versa and brought it back in. And while COVID and polio are very different diseases, they're caused by very different viruses and they spread in different ways. There's some things that they have in common. And they are similar in that most people who are exposed to the virus have few, if any, symptoms. Only a small minority get very serious disease, and an even smaller minority die. So because of that, both polio and COVID can be spreading in a community before it's recognized. And of course, circulating virus, whether it's COVID or polio anywhere, can seed in an outbreak in another country. And that means we have to pay attention to COVID and polio everywhere in the world, because what happens in Malawi affects us, what happens in the United States affects them. When it comes to infectious diseases, as with so many other things, the destiny of all the world's people is inexorably intertwined. And I think the lesson from Malawi is you can be doing everything really well and bad things can still happen. We have to keep our guard up. We have to make a commitment to working together to control COVID globally, control polio globally, control all communicable diseases that we can globally. We're very, very fortunate that for both polio and COVID, we have highly effective vaccines. We have to make sure that everyone has the opportunity to get them and get them quickly. So the pandemic is slowing down, but it's still nowhere close to over. And what should we learn from Malawi? We should learn that all of us are in the same boat together. There's a great deal more information about COVID-19 on the College of Public Health website. If you know anyone who'd enjoy getting these videos, please let us know. We'd be happy to add them to the mailing list. As always, I'd like to thank Dara Young for editing, producing, and posting this video, which unfortunately today we had to do twice because of poor internet connection. If you have any questions about what I've said today or any aspect of the COVID pandemic, please let me know. I look forward to hearing from you. Until next week, please be well. Thank you.